Hey fam, it's Dr. Rick again with the second video in our series on bruxism diagnosis and treatments. If you haven't seen the self-diagnosis video yet, jump up here and have a watch. Today, we're going to talk about home remedies for relief of your symptoms, home exercises that can help to improve the condition, and when it's time to see a professional for intervention. As promised, here are 5 things that you can do right now at home that will give you short-term symptomatic relief of the muscle or joint pain. Number 1, warm, moist heat. Something like a heat pack or a hot water bottle wrapped in a warm, moist towel can improve function and reduce pain in the muscles. Number 2, counterintuitively, is the opposite, ice. Ice can decrease inflammation and also numb the pain and promote healing. Don't put an ice pack straight on your skin, and also don't use it for more than 10 or 15 minutes. Number 3, soft diets. Just like any other muscle that gets sore when you work it out really hard, rest is the key to recovery. Switching to soft or blended foods can allow the jaw to rest temporarily. Do your best to avoid hard, crunchy, chewy foods, and don't stretch your mouth open to accommodate foods like corn on the cob or apples or whole fruits. Number 4, over-the-counter analgesics. So short-term use of things like ibuprofen, non-steroidal anti-inflammatory drugs can provide temporary relief, but just as with any drug, be careful of other drugs you're taking, having an allergy, or asthmatics. Number 5 is magnesium supplementation. Magnesium has been shown to improve relaxation in sleep and also to help with sore and tired muscles. So, now that you have some relief from the immediate pain, you don't want to just continuously treat your symptoms. You actually want to get to the root cause and improve the situation for the long term. Here's what you've got to do. Number 1, jaw stretches and mobility exercises. Slow and gentle jaw exercises can help to increase jaw mobility and to promote healing. Your healthcare provider or physiotherapist can evaluate your condition and suggest appropriate exercises based on your individual needs. We've made a few videos of exercises and stretches which you can also watch just up here. Remember guys, we've gotten to this point as a result of unconscious clenching, which has formed a habit, so holistic treatment will be looking at essentially breaking the pattern and reprogramming you into healthier habits. So the next crucial element of breaking the habit is relaxation techniques. These will improve the body's response to stress. Slow breathing enhances relaxation, modulates pain sensations. Some have found yoga, massage, meditation helpful in reducing stress and aiding relaxation by forcing the stress into the front of your mind so it can be acknowledged rather than just being pushed down and bottled up. In addition to these methods, some things that can make your tension and pain worse that you should really avoid are clenching and grinding your teeth. So at this stage, if you catch yourself doing it, just stop. Number 2 is chewing gum. It just acts as extra strain on the chewing muscles and doesn't let them rest and heal. And number 3, cradling your phone like that in your shoulder, it'll irritate your neck and jaw muscles. Also, generally, it's best to use your phone and just screens in general at a minimum because they're very highly stimulating and that adds to your stress levels. It may sound easy enough just to break the habit yourself, but often we've found it's a lot easier said than done. So if you cannot maintain consistency with these conservative treatments, it's definitely best to seek professional intervention. Even though the answer will still be stop or disrupt that clenching habit, these medical interventions are aimed at physically preventing your body from being able to damage itself further while you're still in this habit. It'll allow you breathing room to address the habit at your own pace without your body being irreversibly damaged in the process. These professional interventions are: number 1, see a massage or physiotherapist that is trained in managing jaw muscle tension. These are professionals and they understand the interrelations of the muscles, and their professional physical manipulation of the muscles will be more deliberate and guided than your own self-massage. This intervention is recommended in conjunction with professional method number 2, which is splint therapy. Splints are available from your dentist. Please avoid over-the-counter splints because they can be completely non-protective and they'll move your teeth out of position. At the very least, a splint will act as a buffer between your upper and lower teeth by separating them during times of intense stress while you're unconscious and sleeping and while you're training or lifting really heavy. Because we've been in stressful times, here is my splint that I wear every day when I sleep, when I'm training, and also at work when I'm really stressed out. At best, a splint will create an ideal relationship between your upper and lower jaw, allowing it to be positioned in the perfect position for relaxation of the joint and of the muscles around it. If you do end up being treated at Tailored Teeth, we have a couple of specialized tools that are not commonly available elsewhere, and these are professional intervention number 3, photobiomodulation for laser pain relief. Looks like this, and uses a laser to actually relax the muscles. Finally, muscle relaxant injections. This provides between 3 to 6 months of relief, and it'll physically stop your body's ability to clench with the same force. Guys, clenching and grinding and muscle tension is incredibly destructive, not to mention uncomfortable and worrying habit to be stuck in. Get in touch with the team if you have questions or concerns about anything that we've covered today, or leave a comment below. Also, if you've ever caught a friend or family member clenching their teeth together like this, send them this video. You may save them considerable pain and expense if we can get them out of the habit in time. I hope you're all staying healthy and safe. Take care, and as always, keep smiling. We'll talk soon.
Thank you so much for watching, guys. If you got something out of this video or if you enjoyed it, please share it with your friends. Otherwise, there's much more on our channel right here. There's another one there, and there's one more right there. Hopefully we'll see you soon. Keep smiling.